I'm sure you're here because you're wondering about the title: Why Doctors Can't Diagnose Without the Lab. That is quite the statement or the inquiry if you know nothing about the medical profession. But I'm here to rope you in. So, let me give you a storytelling type of educational explanation. So, you're sick, or you're having a baby, or you're doing something that requires medical attention. You go to either a clinic or you go to a hospital, and the doctor is basically making a guess on what potentially could be wrong with you and guessing what treatment options that they can do to alleviate whatever type of issue you came in there for. Now, the doctor, where they come in, is they decide which analytical technique needs to be done for them to feel comfortable enough to treat you based off their guess. Because remember, without a laboratory, the doctor is just guessing. Say that you go into the clinic or hospital with certain symptoms like, oh, dizziness, fatigue, and the doctor is probably, you probably are just dehydrated. But still, what they're going to do is they're going to get you some blood work. And with that blood work, they'll do a chemical analysis and say, the substances inside their body, let's measure them. They're also going to do a complete blood count. So let's take a look at their blood cells. Another thing that they'll perform is a urinalysis. Let's see what their different organs are producing. Let's see what's in their urine chemistry. Because all of those things can indicate why you're having this dizziness or this fatigue. Now, once they actually get those results, then they'll know how to tackle whatever issue you came in there with. Because without it, they're just, oh, maybe it's this or maybe it's that. And they'll get a definite answer once they get results from the lab. And I want to go back into this, oh, you're pregnant and you're going to see the doctor. So the doctor, say you're coming in, you're like, I don't feel too well as a pregnant person, which very much possible. So one of the tests that we perform on pregnant women is the fetal fibronectin test. So what the fetal fibronectin test is we basically get a sample from the woman and we analyze whether the placenta had ruptured. Because if it had ruptured, that means you're in the beginning stages of labor, which means you probably need to either stay at the hospital or be very much aware that baby is coming through. So that's one of the tests. And then there are other symptoms like, say that a patient has sickle cell. I love a good sickle cell patient. And shout out to the people who are the sickle cell warriors that live through these crises, or if you know somebody with sickle cell, all the best to y'all, because there is no real treatment options. They're literally just drugs, given pain medication, and blood transfusions just to stabilize you and keep you going until the next crisis, which I think is terrible. We need to do better as biomedical researchers, as medical professionals, to get them the help that they need. Say that this patient comes in and they have sickle cell. They have a history of sickle cell. We already know that they are one of the sickle cell warriors. They come in and then they're in pain. They have all type of issues that are associated with the sickle cell crisis. So what we're going to do is we're going to do a hematology screening on them. So when we get the hematology screening on them, it's going to tell us what their blood cells are looking like. We're going to figure out if they're at the critical stage to where they need a blood transfusion, or they're at the stage where they just need maintenance. They just need the pain medication until the crisis is alleviated. So those different things can only be done through a laboratory. Say a patient is coming in coughing, sneezing, wheezing, and the whole nine. We can't say, flu. You have to be very much specified in the respiratory infection. You have to make sure that it's not a bacterial infection. You got to make sure that it's a viral infection. You can't just assume that the patient, because they have a runny nose or if they have a sore throat or a cough, has the flu. You have to literally get swabbed and you have to get an analysis on Basically, you can either do PCR or you can do a rapid test. Some rapid tests can cover a lot of respiratory infections, and some PCR tests can cover a lot of respiratory infections. The whole point is you can't just sit there and because someone has a runny nose, guess and say that they have the flu. You have to make sure that whatever this person has, the treatment option is specified for that. Without the laboratory, you cannot do that. Okay, I know I'm gonna get a little, a tiny bit controversial here. So at first, just know that I finished my video completely. I was done with it, but then I watched it back and I did want to add something. And this is no shade to the medical professionals who are prescribing these antibiotics. Let me tell you this. I know you guys heard of antibiotic resistance. Now, I think one layer that we should address is that one of the reasons is people are prescribing antibiotics at pretty much anything. And I don't mean anything, but I just mean things that have not been determined and solidified and defined within a laboratory. So say that you, again, let's use this cough respiratory scenario. Cough, cough, now throw antibiotics at you. Now what you have done is destroyed the healthy microbiome within someone's body, because what you did was just, I don't know what bacteria it is, but let's just throw these antibiotics at it and just hope that whatever infection is there is cleared. Or they'll throw the bacteria, they'll throw the antibiotics at you, and then later they'll conduct the testing to figure out what is inside that needs to be killed. To me personally, I'm not a doctor, I'm not a nurse practitioner. I do think that's backwards as hell. If the person is already sick, shouldn't you figure out what they're sick from before you decide to give them antibiotics? I'm not the smartest in the world. I just have this big brain and this big head, and I just be trying to use it. Context, clues, everything. My thing is, this is why, again, the laboratory profession is so important. Because instead of just throwing antibiotics at any symptom that you deem a bacterial infection, shouldn't you actually see what is wrong with this person first, then decide to give them antibiotics? And if you feel like the time frame is not good enough, this person is already sick, shouldn't you figure out how to make them less sick rather than making them more sick? But I would say delay the care. Delay the care depending on the severity of the current situation. Because if someone is already sick and coming to you, I think they can wait a couple of hours depending on if they're in a hospital, or less than a couple of hours if they're in a hospital, especially if you making sure that their sample is sent down as stat. Shouldn't you delay giving them treatment until you actually get results back? Say if somebody comes in with a respiratory infection, shouldn't you delay the care, delay the antibiotics until you actually know what specific bacteria, fungus, virus is affecting them? And and I think that is also a conversation about the antibiotic resistance. It's because a lot of medical professionals are willy-nilly, because they have the rights and privilege to be able to prescribe you things. Now you got amoxicillin for everything, or now you got these different antibiotic classes for everything. So they just throwing it at you because let me give you something. Just here, shut up. You know what? And I don't think that's fair to the patients, especially when they have professionals like me whose only job is to provide results so that you can have specified treatment for these people. But I just wanted to insert that clip, and it's not more so to like diss anybody, but it's just to add another layer of this is why we are here. Our job is to give you the specifics of what's going on inside this patient's body so that you can have a specific course of action when you're trying to treat them as the doctor. And yeah, that's pretty much it. That's it. Let's do another example. Say that someone comes in with a little cut on their arm or whatnot, and then you look at the cut and you're like, this person can just wrap it up, go home. No. The best course of action to do as a medical professional is to swab it. Let's see if they have an infection. And that's one thing that if you have open wounds or just certain things need a certain type of follow-up. And a laboratory can tell you if it was valid or invalid, or if you need to go through different studies to figure out an alternative solution to whatever symptoms this patient is having. So say that you do a swab and then you find out this person has a staph infection. Now you have to get them their medication that they need to make sure that this staph infection is killed. So just little things like you're not able to see with your naked eye bacteria. That's why you go to the microbiology department. And micro as in naked eye, not visible. Macro is what you can see. Micro is what you need a microscope for because it's so small. So the laboratory is so important. Doctors are important. The whole medical professionals, everyone's needed. We need down to the nurses, down to the EMS team that sanitizes and cleans everything. We need everybody inside the medical profession. So there's no higher or lower. Everyone is critical, because is your doctor gonna make sure that your bed and everything is sanitized? Is they washing those sheets after patient? Is they cleaning them floors? Are they sterilizing them instruments? No. That's why everybody has their role and everybody is critical to the entire process so that patients are taken care of properly. So laboratory professionals, they are critical to the entire process. We're not the main piece, but we're a critical piece. Just like all of these other pieces that fit together to make sure that these patients are being handled correctly and are moving into the healing process, because that is the goal of healthcare, is to heal humanity. That should be the goal. As a person working in the medical field, it seemed like finances is more important than anything, but that's neither here or there. The whole point of me bringing you guys this video is basically to talk about the purpose of a laboratory professional in relation to a doctor. We are highly critical to a diagnosis from a doctor, because without us, a doctor is literally just guessing. We're the ones that provide the results so the doctor would know how to treat the patient. And that is why we are critical in the piece of all the pieces, the whole piece of the medical care scenario. And yeah, that's all I want to give you guys. And thank you for tuning in to Rough and Pink. I'm Terry. Enjoy the rest of your day.